Ladies and gentlemen, welcome here within the International RFID Congress, and it's a big pleasure to welcome you, WINJIE, Miao. Welcome to Marseille. You belong to the Methodist Hospital Center Harris. Could you describe what you're doing every day, WINJIE?
Sure. I'm the president of the hospital, and as such, we manage the day-to-day operations of Texas Health, Harris Methodist Hospital Alliance, and the hospital is a member of a much larger system across North Texas with over 25 hospitals in total.
Oh yes, a huge, huge business and huge responsibility. Within your hospital, what RFID technology have you implemented in the hospital?
So we have active RFID tags, and we tag all of our equipment, we tag all of our patients, and we tag all of our employees, all of our staff, so that we can get real-time data on what's going on throughout the hospital.
It's a tremendous example. I've never heard about such a wide implementation of RFID technology. So next questions, why did you choose to invest in this technology?
So before I worked in healthcare, I was an engineer, and I once worked in a soap factory. And it always struck me when I got into healthcare that I had more data and more information on how soap traveled through the factory.
It was a paradox,
than the hospital. And so by putting in this technology, the investment is small compared to the savings in equipment, the savings in staff time, the savings in productivity, because we're able to not only track equipment, we're all able to also use rules to automate tasks so that nurses have more time at the patient bedside rather than filling out paperwork or typing in systems.
Yes, we see exactly the benefits of this technology. Last question, how was the technology improved hospital, was the technology improve hospital performance and outcomes?
I think there's a couple ways we've done that. You know, first on the equipment side, which is usually what people think of, the equipment, we don't have a before and after because we opened the hospital with the technology, but I can tell you in 2 years we haven't lost a single wheelchair, I haven't bought a single replacement item because we can see where everything is in the hospital. And also then nurses aren't searching for those pieces of equipment when they need it. We know exactly where they are. We position them in the hospital based on PAR levels, and so every morning, every department starts with the amount of equipment. That's a positive.
Time saving, money saving, and efficiency everywhere.
The second piece on a process side is because we have patients that are tagged, we can automate processes. So one example is rather than a nurse having to discharge a patient through 4 different systems before they can leave the hospital, we actually cut off the patient tag, drop the patient tag into a box. The box has a reader in it, and when the tag hits the reader, it automates the process, and so it discharges the patient. So from an outcome standpoint, we're able to reduce our turnaround time for a patient room from normally 40-some minutes for most hospitals in the 20-some minute range.
Amazing, amazing benefits for interesting technology.
Yes.
Thank you so much for this return on experience. Something to add if you have to provide an advice to an hospital considering the opportunity to invest in RFID technology, what will be your last advice, WINJIE?
I would say definitely don't just put in the technology, but also look at how you can change your processes so that you maximize your value and your return on investment from the technology.
Thank you so much, WINJIE Miao, Centre Hospitalier Methodist Harris. Thank you so much.
Thank you very much.